All right, welcome everyone. Welcome to our virtual Global Health Forum, Preserving Mental Health During the Global Coronavirus Pandemic. My name is Parmi Suchdev, and I'm the Professor of Pediatrics and Global Health and Associate Director of the Emory Global Health Institute. For those of you who might not be familiar with the Global Health Institute, our goal is to advance global health across disciplines through collaborative, innovative, and impactful discovery, scholarship, and service. We host these regular global health forums to convene both Emory and non-Emory stakeholders across disciplines to discuss timely topics in global health. We are pleased to have here with us today an amazing group of experts from partner organizations, including WebMD, the Georgia Global Health Alliance, the Centers for Victims of Torture, the Global Health Office of Pediatrics at Emory, and the American Academy of Pediatrics. The views and opinions of our panelists are our own and do not necessarily represent the position of the host organizations. So we're here today to talk about mental health during the global COVID pandemic, which as of today has reached nearly 2 million cases and over 121,000 deaths. We chose this topic of global health because preserving the mental health of our frontline health workers, our children, our parents, and the general public who are socially distancing or in quarantine is just as important as protecting ourselves from the virus. And often this topic of mental health has not been covered extensively in both the academic community as well as the media. Further, the economic impact of this pandemic disproportionately affects poor countries and those in middle and high income countries faced with racial and economic inequities. So here's our plan for the webinar. I'll introduce each speaker and they'll give a short overview of the following topics. After their presentations, we'll have a moderated discussion using the questions you all submitted when you registered for the event. We received hundreds and hundreds of questions, so apologize if we don't get to yours. You can also enter your questions in the Zoom question and answer box, and we'll try to get to these as well if there's time. And also this webinar will be recorded, so you're free to share it with colleagues who might not have been able to attend today. So I'd like to introduce our first speaker, Dr. Hansa Bergava, who's a senior medical director at WebMD. She's a board certified pediatrician and served on the American Academy of Pediatrics Committee on Communications and Media. Dr. Bergava will be talking about the impact of stress on children, families, and parents during physical distancing. Dr. Bergava, I'll turn it over to you.
Thank you, Parm, and thank you for having me on this very important forum on mental health. So, you know, from a parenting, stress, and mental health perspective for COVID, I just want to turn back the page to what was the state of the nation before COVID. And, you know, I've spoken about this, you know, various times last year, and there was plenty of studies that actually came out last year showing that there was anxiety on the rise in our kids. Journal of Normal Psychology published a study last year that showed that depression was actually on the rise and increased by 60% in the ages 14 to 17 over a span of 5 to 7 years. We also know that suicide rates were on the rise as well. They more than doubled, and the CDC reported that it had jumped 56% between within a 7-year span, I'm sorry. And also, you know, we know that there was an issue with parenting stress as well. There are multiple articles that talked about stress and, you know, parents coping with various amounts of stress. Can I see the next slide, please, Parm? So also, we do need to address the fact that there's disparities in this nation. That includes both in cities and rural areas, but also, you know, in inner city populations as well. A lot of parents essentially live in a pressure cooker. Next slide, please. About 1 in 5 children we know are living with a solo mom. Some are living with grandparents, and this means a lot of pressure on that single parent that is trying to sustain a job, as well as be the parent at home, provide food for the children, as well as child care and the support, emotional support that children need. Next slide, please. We also know that before COVID happened, that there was a section of the social economic strata that was actually really pressured from a dollar perspective. In fact, what has been shown is that inflation increases, the wages have not increased, and so a certain segment of the population is under the crunch for economically as well. Next slide, please. And then we also know the American Academy of Pediatrics has made a lot of statements about this. We also know that 1 in 4 kids are food insecure. So, and depend on those meals that are in schools as well. Those are factors, and again, next slide, please. Those are factors that were pre-COVID in terms of the stress and pressure that parents and families felt. Now we basically have social distancing, which of course from a medical standpoint is extremely important and has worked in cities across the nation to flatten the curve. However, just like anything else, there are consequences. And here we have isolation, we have job loss. There was large numbers reported on unemployment just last week. We know that 16 million people have lost their jobs, and these unfortunately tend to pressure the segments of society that I was just speaking about that are already under tremendous pressure. And what today we will talk about is some of the consequences of that, which include domestic violence, when people feel that pressure, child abuse, which is on the rise even by initial opinion pieces and surveys, and also the strains felt even from an economic perspective on gatekeepers as well, including doctors and psychologists and psychiatrists who depend on patients as well to keep their practices running. And we've also seen some policy statements from the American Academy of Pediatrics about that specifically to pediatricians. Next slide, please. So in terms of prevention, we'll talk about this more, but typically there's 2 aspects to this, just like any other disease, and that is prevention and then treatment. So prevention is basically, the mainstays, which is encouraging sleep and physical exercise, socialization via virtual issues, which we do have technology, thankfully, and actually taking media diets, which I'll talk about more, and then also just in the interest of time, I'll keep this really short, but for acute stressful situation, timeouts for parents and kids, letting go of arguments and tantrums, calling out for support, and then relying on telemedicine technology for therapeutic measures as well. And I think that's all I have, and I'll talk about this a little bit more, and I will talk about, as the discussion goes on, about technology that can kind of interface and help us when we need treatments. And there's a lot of great things out there that we didn't have access to before, which includes not only telemedicine, but also crisis text lines, for example, but texting for help, as well as chat bots and wobots and other types of technology interfaces. And then of course, luckily there's the organizations that are also putting together webinars like ourselves, and also Child Mind Institute, as well as the AAP that's helping getting information online, and WebMD. Thank you.
Parmi, you're on mute.
So next we have Dr. Heather Hawk, who's an assistant professor in the Department of Pediatrics at Baylor College of Medicine and is a pediatric hospitalist at Texas Children's Hospital. She serves as the Chief Medical Officer for the Baylor International Pediatric AIDS Initiative. She's also an executive committee member of this AAP section on global health. She's a leader in global health education and draws on extensive experience living and working in low and middle income countries. So Dr. Hawk will discuss mental health of frontline healthcare workers globally. Heather.
Okay, thank you, Dr. Suchdev. So I will focus my comments today on my perspective supporting our colleagues at our BPI, Baylor International Pediatric AIDS Initiative sites in low and middle income countries. Many of the ideas and concepts that I discuss will also apply to settings here. The bottom line is we're all in this together across the globe, and there's a lot that we can learn from one another and share bidirectionally with partners in low and middle income countries. Next slide. So for context, let me share a little bit about BPI. So we support a network of locally run foundations and clinical centers of excellence across the globe, particularly in sub-Saharan Africa, Eastern Europe, and Latin America. And these are some of our leaders on the ground at the sites. Next slide. Initially, we were focused on pediatric HIV, but over the last 2 decades have grown to support a robust portfolio of initiatives supporting maternal and child health using a health system strengthening approach. Next slide. So I want to talk just briefly about COVID-19 and what the impact may be in low and middle income countries. What we're seeing is a slower importation of cases. And because these countries have weak and strained health systems at the baseline, they're really vulnerable. We know that many of these countries have vulnerable populations, both biologically vulnerable from comorbidities and also economically vulnerable with high rates of poverty. We know that the health systems are working with profound resource limitations. And when we think about limited resources in the US, much of the talk has been about do we have enough ventilators? But in many of these countries, the number of ventilators is just a tiny fraction of what we have here. And they're really going to have severe resource limitations to treat severe COVID disease. So unfortunately, widespread COVID in these countries will cause devastation and death, will strain health systems, and it will cause backsliding on other important child survival and sustainable development goals. Next slide, please. When we talk about social distancing or privilege or physical distancing, I want to remember that it's a privilege. This is a picture from a slum in Kampala, Katanga slum, where you can see the living conditions are very crowded, and it would be difficult for people in this type of environment to physically distance or to suspend activities that support their daily livelihood. Next slide. I also want to remember that many of these countries exhibit profound amounts of resilience, resourcefulness, and innovation that will be necessary to take them through this pandemic. There's a lot of lessons that we can learn from sub-Saharan Africa in their response to the Ebola outbreak in West Africa. And I'd actually like to start by, next slide, examining what we know about mental health of frontline providers from Ebola in West Africa. A study found that frontline providers in this setting experienced acute stress, trauma, witness to suffering, loneliness and isolation, sadness, anxiety, fear, dehumanization, and stigma towards healthcare workers. The authors of this study proposed that they would need psychosocial support, culturally acceptable interventions, and public communication to address stigma and address the lasting PTSD. Next slide. What we're doing in BPI. So first of all, we are emphasizing workforce protection as the priority, and this actually has a big impact on mental health. Health workers cannot feel secure and safe if they don't have infection control and PPE available. We're also emphasizing mental health and self-care as an important component to workforce protection. We have daily phone calls with leadership that, although they were started to talk about operational issues, have become an important venue to share coping strategies, problem solving, and support one another in solidarity. We have a WhatsApp chat group and a resource library for sharing mental health resources and fostering connection. Next slide. We have many things in the works. Some of our sites have started doing mental health screening of staff. We're working on developing a peer support mechanism and looking into options for remote psychological first aid. For example, could we use HIV counselors who already have background in mental health to provide counseling for COVID-19 distress for health work? We've done mental health training for all clinical staff, and remembering that all of these interventions have to be culturally acceptable. Next slide. I wanted to introduce briefly the concept of psychological first aid that can be used in settings of disaster and trauma and carried out by any trained provider, not necessarily a mental health professional, with a focus on safety and empathy. The International Federation of the Red Cross has great resources on this. Next slide. And finally, I wanted to just make a few remarks about the term social distancing. I think that it was a misnomer from the beginning. And what we actually need to be fostering during this time is social connection in a time of physical distancing. And this is in line with changed terminology that the WHO has adopted around social distancing, now using the term physical distancing. And I would encourage all of us to use the same terminology. Last slide. And that's all from me. Thank you.
Thanks so much. Thanks so much, Heather. And so next we have Dr. Adobe Ihederu, who's a licensed clinical psychologist and the clinical manager for the Center for Victims of Torture here in Georgia. In her role, she provides psychological assessment and torture treatment to refugees and asylum seekers who are survivors of torture and war trauma. She also provides program management, clinical leadership, and supervision to the clinical team. Dr. Ihederu's clinical and research interests are in refugee and immigrant mental health, integrated healthcare, diversity inclusion, and multicultural competency. She'll be discussing challenges preserving access to mental health for immigrants and refugees during this pandemic. Adobe?
Thank you, Parmi. I'm excited to talk a little bit about the experiences of immigrants and refugees. And I want to preface this by saying that what I'm going to speak about in no way represents all of the experiences of refugees and immigrants all over the world. It's based on our experience working with refugees and immigrants here in Georgia. First slide. So I'm going to start with the impact that we're seeing on refugees and immigrants so far based on what clients are reporting to us and what we're hearing from the field and the different places where our clinics are located. First, we're hearing that the situation serves as a trigger of war trauma experiences for clients. For example, empty, deserted streets remind clients of war trauma experiences where perhaps in their countries where there was war and people had to flee, the streets were deserted and no one could be seen. So it's triggering memories, traumatic memories of those experiences. And as we know, most states are now having the shelter-in-place orders. But for clients who are refugees or immigrants, this also could serve as a traumatic reminder of experiences of imprisonment or detention. This is particularly important to note for asylum seekers who may have experienced immigration detention at some point. This is, we've heard from clients that this is a reminder of times that they were in detention, and people have said that they feel like they're in jail again. Also, as we know of mental health symptoms, for some individuals, increased isolation exacerbates symptoms of depression, PTSD, anxiety, and we're seeing over time that these symptoms, clients are reporting that their symptoms are worsening over time because they're in isolation, they lose social connectedness, and they feel that they're having to cope with all of their symptoms alone. And next is the threat to basic needs. And I think this is the highest risk for refugees and immigrants at this time that we have observed and heard about. The loss of employment. Most refugee clients that we work with are working in food production companies, hospitality, and restaurant industries. And because of that, some of them have lost their employment, or some are reporting that they are unsure about the guidelines for continuing to work, or are struggling with the decision if they continue to work in order to preserve finances for their families, or if they stop working for safety reasons and are battling with that decision making. Food insecurity, as was previously mentioned as well, is a concern that's come up with clients due to loss of employment, not being able to provide food and resources for the family, but also not being able to access groceries. So a lot of refugee and immigrant clients that we work with do not have access to consistent transportation and may only have one grocery store close by. And as we know, grocery stores are running out of items, and as such, they may not be able to access what they need, but are also not able to travel to other grocery stores as other people might be able to. to secure what they need. And then the loss of support in meeting needs. In meeting their needs, this includes healthcare access, activities of daily living. A lot of refugee clients may rely on organizations such as ours to understand things like their mail, bills, what they need to do to schedule healthcare appointments or to reschedule canceled appointments, and not knowing, having the knowledge of whether these organizations are still open is a concern. So people are not following up, clients are not following up with appointments, are not reaching out for help because they don't quite understand what's going on, or if these organizations are still available to them, which is then limiting their access to services. Impact on the family system. Parents as teachers is what's going on everywhere for most people. However, there is a conversation that's being lost there of parents who do not speak English and are not able to teach their children. So clients are reporting a high level of distress because they're not able to even understand what is supposed to happen with their children. They're not able to teach them, they're not able to guide them. And they also worry about how to reach out to the school to receive guidance. They're also in distress about the impact this will have on their children's education long-term if they're not able to provide the services that are needed at this time. And then parenting difficulties and increase in family discord, as was previously mentioned. When we have refugee clients, parents who are survivors of trauma or torture, who are experiencing trauma symptoms, anxiety symptoms, they may not be readily available to parent in the way that they're needed to in this moment and this time. So they're parents who are experiencing high anxiety or basically withdrawn from their kids, and as such is leading to family discord, behavioral problems within the home. Next slide, please. So some challenges to accessing care, which I've already mentioned. So language barrier, which is a big issue. Clients have reported that sometimes they've received messages that their appointments have been canceled due to COVID, but they do not have the ability, due to language ability, they're not able to contact the clinics to reschedule appointments or to figure out how to schedule a telehealth appointment. In addition to that, when appointments are scheduled, there are additional steps that have to be taken to ensure that individuals are able to receive services in the language that they are able to understand and prefer. The lack of access to technology, which is a big issue. I think that an assumption has been made that people are able to access telehealth. They have technology. We all have phones. Well, maybe not everyone has phones. That's one issue to note. But also, even if our clients have phones, refugees and immigrants, sometimes there is not an ability to consistently pay the bill for that phone. Most of our clients who are refugees do not have Wi-Fi in the home, so they're not able to access technology as would be expected to complete telehealth appointments. And so that's an issue to address, an advocacy issue to address. And issues in the home environment, like was previously mentioned as well. Refugees and immigrants sometimes typically are living in crowded home environments with multiple family members. And so privacy is a privilege. People don't have the privacy to complete a mental health appointment by themselves in a room without interruption. There are kids within the home. There are a lot of family members within the home environment. And then the home environment might be unsafe or inadequate. We have a lot of asylum seekers who are either sleeping on people's couches or sharing rooms with multiple individuals. And as such, they're not able to complete these appointments on their own. Then the distrust of technology, institutions, and uniform personnel due to history of oppression. The expectation is that individuals will reach out for help when they need it, but for refugees and immigrants, this may not be the case because there's this history of oppression. There is a distrust of individuals, of institutions, and as such, people are less likely to trust that their best interest is at heart. We have clients who are refusing to continue mental health services because they're afraid of their sessions being recorded. They're afraid of what will happen with the information that they're sharing on technology, which is understandable. Next slide. So this is the last slide. These are some considerations to ensure equity for this population. It's important to just acknowledge the disparities and to confront the inequities, demonstrating knowledge of immigrant and refugee experiences, or asking rather than waiting to be told. I think as we work in this environment, we're all working in overdrive. We're setting different rules and different expectations quickly, and to ensure that we continue to provide services in the healthcare world. However, it's important to slow down and think about how will these decisions impact marginalized communities, and addressing those inequities up front and asking questions rather than waiting for people to ask for help. Utilizing our role and our power for advocacy within the community, within institutions, flexibility in expectation and plan implementation, again, to ensure that the most marginalized and vulnerable are being served, collaborating with community-based organizations and seeking support and consultation from them, because these organizations or community partners or faith-based organizations know how best to serve their communities. So seeking support, asking questions of how to reach these communities and better serve the underserved. That's all. Thank you.
Fabulous. Thanks so much. So last but not least, we have Dr. Rachel Wofford, who's a licensed clinical psychologist and an assistant professor in the Hubert Department of Global Health at the Rollins School of Public Health, as well as the Department of Psychiatry and Behavioral Sciences at the School of Medicine here at Emory University. In addition to her community-based clinical practice, Dr. Wofford focuses on the study and practice of global and community-based mental health. Today, she'll give us some practical mental health tips for both individuals and communities. Turn it over to Rachel. Thank you.
There we go. Thanks to Parmi and the Global Health Institute for this panel. So you can go on to the next slide, Parmi, thank you. So what I'm going to do today is just give a very brief review of the context and why mental health is so important to COVID. And so I think what the biggest takeaway that we can learn from our current experience is that we're really getting to learn a lot about what our system or how our system is serving our individuals with lived experience and our most vulnerable populations. Everything we're being asked to do right now to take care of ourselves and our fellow community members requires cognitive, emotional, and behavioral capacity to be able to understand and to carry out all of these guidelines and recommendations. And so we're learning that if we haven't been taking really good care and providing really great access and resources to our vulnerable individuals, then it's really impacting their ability to care for themselves and for all of us to work together as we respond to this pandemic. I think something else I'll just highlight here is that we will have a new cohort of mental health clients when this pandemic is over. And so these might be folks who may not typically have been as vulnerable to experiencing distress or developing a mental health condition before the pandemic, but folks like our frontline healthcare workers, our COVID patients who have recovered, family members who have been caring for loved ones or have lost loved ones, individuals who've been victims of xenophobia related to the COVID crisis. And so we'll really need to ensure that we have a response that is ready to serve an expanded cohort of individuals who have been suffering from fear and anxiety and isolation related to their health and the health of people that they care about. You can go on to the next slide, Parmi. So as a clinical psychologist, my goal is to ensure or to work as hard as I can to ensure that people have the resources and strategies and skills that they need to respond during times of distress. And it's exactly where we are right now. So I want to finish our talk today by pulling everything together that everyone has talked about and give some real tangible examples that people can use for themselves or to share with people in their lives. The first thing I'll invite folks to do is really to open up to the distress and discomfort that we're all experiencing. It is perfectly normal to be scared and anxious and confused and maybe even angry. And sometimes we put extra pressure on ourselves to feel differently or to feel better in times of distress. And so I would just invite everyone to let themselves be okay with having all the feelings about what's happening around us. And you don't need the added pressure to somehow feel better or different about that. Really want to encourage folks to, as other people have mentioned, to take time out, to prioritize any kind of coping or pleasurable activity that you have time for, whether that is 30 minutes or whether that is 30 seconds. We all need a reservoir or fuel to effectively engage with all of our commitments. And that fuel and that reservoir comes from taking those breaks, engaging in things that are meaningful to us. Again, whether it's 30 minutes or whether it's 30 seconds, because everyone has a different capacity and access to different kinds of resources. Physical activity is one of the best things that we can do for our minds and our bodies. Not only is it great for our mental health and well-being, but it does boost our immune system, and it assists in the prevention and treatment of chronic disease. So it's really something that we can think about with our bodies. Folks have mentioned already before about media diets or limiting information. And so I want to encourage people to narrow down your sources of information to one news outlet and a few other sources of information, whether it's blogs or other things that you enjoy, and check them once a day. Right now, we're all getting so inundated with information that it can feel really overwhelming to know what to do or who to help or how to respond. And so if we can limit the intake of that information, then we create space to do other things that fill that reservoir that I was talking about. This is a brand new time, so why not consider new ways of coping and taking care of yourselves that you hadn't thought of before? A lot of our old rules are out the window right now, so why not approach this with curiosity and creativity? So maybe you never did puzzles before, or maybe you never enjoyed walks before, but maybe now is the time to try something new, since pretty much everything around us is new right now. So it's finding a way to kind of embrace that. And finally, there are a lot of mental health resources that are free right now. And so encouraging the use of any of these, trying out as many of them as you can or have access to. As people mentioned, there are different levels of access, and information is certainly a privilege at this point, but utilizing any resources that you might have available to you. And I think if you're just showing up and trying, then you're doing it right. Doesn't mean it doesn't have to work perfectly. So even if you're doing a 30 or a 1 to 2 minute meditation and you're giving it a shot, you're doing that work to create space. Next slide. The best thing that we can do, or one of the great things we can do to care for ourselves, is to care for others. We get a lot of fuel from that as well. So there's a couple things or a few things I'd really like people to take away from today. First, just remember that everyone around us is suffering in some way, and we can really support one another by just being kind. So being thoughtful in how we're speaking to each other and how we're treating each other, whether that's in person with the folks around us, or even whether it's with those comments, on Facebook or social media. So just take a moment and decide, is this something that would be meaningful and helpful? And if not, maybe decide if it's something that you need to communicate. Given that we all have limited resources and time and capacity right now, while it is helpful, while we do get a lot from serving others, please feel free to create boundaries in how you do that. So reaching out to others with support and serving organizations and people that you care about can do so much for us individually, but please feel free to set boundaries around that. If you only have 5 minutes or $2, then don't expend any more than you have. What you have is enough. Share supportive resources, but with limits, kind of like we talked about before. So I don't want you to inundate yourself, but we also don't want to inundate others. And then lastly, just remember that taking care of yourself first is the best ways for us to take care of other people. Because if we're taking care of ourselves and then we're able to give someone 5 minutes, then we're giving them the best 5 minutes or the best parts of ourselves that we have if we've invested in ourselves first. So hopefully folks can take this information, share it with the people that you care about, and take care of each other. That's all I have, Parmi.
Thanks so much. All right, well, I really appreciate our panelists for giving us some very, very valuable information on the situation. related to some of the considerations for mental health and some of the tips. So I'd like to move over now, get all the panelists to unmute, and we'll get into the Q&A portion. So the first question I have is for the two pediatricians on the panel, Hans and Heather. This was a question that came across quite often related to one of the challenges of clinicians now moving to telemedicine. What red flags would you think could indicate parents being overwhelmed, potentially issues of abuse? And are there specific screening tools or outreach that should be utilized given that these mental health stressors that are facing parents and the effects that could potentially have on their children?
Sure. I don't know, Heather, did you want to speak first or should I?
You can go ahead.
Okay, great. So I think that's a great question. And certainly we all spoke about how the stressors are going to increase the frequency of violence or child abuse just because of the incredible amount of stress that people are feeling, especially in certain sectors and disparities. I think that when you're doing telemedicine, again, as pediatricians, we always rely on consistency and history taking. And, you know, especially with telemedicine, I think there's a big emphasis on history taking. So again, you know, what is the story behind that injury? You know, what exactly, how did it exactly happen? Is it consistent? Does the story make sense? You know, has it happened before? Those are some of the questions as pediatricians we're very familiar with. So, you know, relying even more so on the history because the patient's not in front of us would be really important. And then just having a really low index of suspicion to get the patient in if the patient needs to come in and get diagnostic tests. I'll hand it over to Heather to get her thoughts.
Yeah, I don't have a lot to add. I think we're still learning about how best to utilize telemedicine, and this is a little bit of a new territory for us as pediatricians to use telemedicine to assess patients, and especially for subtle signs of abuse during stressful times. I think another thing that we worry about is increased domestic violence, and as other panelists mentioned, that our patients that we're serving through telemedicine may not have a private space to even relay information of concern to you. So if there's opportunities to create private spaces or have you know, mothers go into a separate space to share sensitive information with you, that would be something else that we could encourage. But I think we have a lot to learn on this. We don't have any specific tools that I'm aware of that we can rely on for really screening for this in the telemedicine setting.
Thank you both. The next question is for Rachel. As for putting on your public health hat, what data are available to allow researchers to examine changes in mental health during this pandemic? There's such a focus on tracking numbers of cases and testing, but how do we collect data on mental health from a population level?
Well, I think that's a great question. And I think there's a few different ways that we can do that and are doing that. There are some surveys that have been circulating recently, getting people's experiences with the COVID pandemic, both their senses of security and safety and susceptibility, as well as how they're coping. There are also ongoing screening tools that were available well before this pandemic occurred. So on Mental Health America, for example, has a number of different screeners where at any point someone can go on and when they're seeking information about how they're doing or if what they're feeling is normal, they can fill out a number of screening tools that can help assess or even just give some context to what they might be experiencing. So I imagine that those surveys are ongoing. And I think we can all be collecting data as clinicians. So even just adding in the question that you asked before, you know, maybe gathering additional sources of information that previously in telehealth we wouldn't have asked. So asking questions about, in general, you know, how are people feeling about their ability to cope, or their access to resources, normalizing distress right now as sort of a baseline experience, that it's opening up opportunities for people to share a little bit more. So I think that's going to be happening. It's happening more formally. And it's also, I think, happening in an ongoing way informally. And I think we're going to see more and more resources that are going to be circulating in gathering this information.
Thank you. And Adobe, a question for you related to equity. I think many of the panelists spoke to some of the issues that are being faced by immigrants, refugees, the working poor. And one of the things you mentioned as an action point is the power of advocacy. And so all of us on this webinar today are individuals, but we're also part of organizations and other groups. Anything we can do to help advocate for addressing some of these disparities, and like that you said very clearly, are tough now, but could even get worse after this pandemic resolves.
Yeah, thanks for that question, Parmi. I think that's a loaded question, but a very necessary question. I do think, as you mentioned, we're all part of institutions or part of organizations, and it's important that there are individuals who are challenging the norm or the plans that are being put in place, and ensuring that considerations for those individuals or marginalized communities that may not typically get addressed or being addressed, or putting the needs of those populations at the forefront, ensuring that people are staying aware of it, whether be it in meetings or in discussions about how to change plans or implement new plans. I think it's also important to educate service providers, healthcare providers, service providers, the importance of having the conversation, of validating and normalizing the experiences that people are having, and making sure that a discussion around inequities that those discussions are happening, that people are not just ignoring it and just focusing on results or focusing on continuing the work, but rather that we're providing a safe space, creating a safe environment for individuals to share their concerns. I think there is power in that, and that is advocacy, being able to attend to the needs of people. So educating trainees, providers to be able to respond effectively, rather than focused on just moving along with our day-to-day, which is, I think, what we're pushed to do right now, or we're moved to do right now, but taking time to slow down.
Absolutely. So one question that has come up a lot is, and this is for anyone on the panel, I mean, there's so much negativity out there. What tips do you have to stay motivated, to stay positive? I know, Rachel, you mentioned limiting our media outlets, which would be great but hard to do. But yeah, other tips. How do we stay positive?
I can jump in on this, Parmi. I actually just wrote a piece for WebMD about that, to how to stay motivated. And personally, I'll be honest, like, I think this is, we're talking about disparities and people with all that pressure, but, even in the white collar workers such as ourselves can feel that way sometimes too. So I think that having some structure in place, if possible, whether that's as simple as, waking up at the same time in the morning and just, putting clothes on to get your work day started, to meditation, as I think Rachel may have mentioned, or somebody mentioned, or having just deep breathing. It doesn't have to, meditation seems like such a big ask sometimes, but even sitting down and deep breathing for a while. And also, the media diets are really important. But the last thing that I feel like we always understate is the importance of sleep. So, sleep really has an impact on your mood and also your focus, your productivity, and just your general health. So if there's any of those that I would mention is the biggest, I think probably sleep is.
And if I could jump in, Parmi, just to add to what Hanso was saying, I think it's also it's becoming really critical, and we're to recognize the importance of creating space for things that feel meaningful and that feed us. And so whether that's activities or whatever it may be, but recognizing that we in a ongoing 24/7 acute response, living in that space is just not sustainable. And right now we're kind of being called to do that with information, with did we wash our hands enough? When was the last thing I touched? Did I touch my face? All of those things, we're sort of constantly in this crisis mode. So ensuring it, adding to the scheduling that Hansa mentioned, scheduling in moments of deep breathing, moments of doing activities that are different than work or these health-related activities to create some balance. We know from decades of literature the impact that chronic stress responses have in the mind and the body. So creating space to balance that with other activities, I think is really critical. And seeing those is just as important as work and the other things that we have on our plate, even if it's just for 1 minute.
Yeah, one thing we've been doing with our family is just going on a kind of a daily kind of walk with the family right before dinner. And it sounds simple, but it's like, I'm like, why didn't we do this before? You know, it's something, you know, I really, you know, I think we've all come to enjoy. The kids kind of look forward to it. And yes, I agree. Just those are really helpful tips. So Heather, there was a question that came up for you during your talk, which was, what are some of the other countries, maybe some lessons learned that to address end of life with COVID patients? Because here in the States, people often are dying alone, which is a significant issue to mental health. Have you come across this at all with any of the countries you worked with?
Yeah, thank you. That's an excellent question. And looking at sub-Saharan Africa, for the most part, they're still pretty early in their epidemics, and so they haven't had widespread death. I think that what's going to happen in many of these settings is that people will die quietly at home rather than seeking care in a hospital setting, because resources are so limited in the hospital setting. But I think certainly palliative care approaches around end of life within COVID for low resource settings is something that we need to be thinking about. And also from, of course, an infection control standpoint, that's going to be difficult too. There's probably lessons that we can learn from Ebola around that as well. Although Ebola was a lot more infectious because of all the bodily fluids involved. But I think this is an area that we're going to be looking at. We're planning to host a clinical forum discussing precisely palliative care and end-of-life care for patients with COVID in low resource settings.
Thank you. So another question that kind of came up. So many of you who are either professors or teachers, work with students. What mental health issues might you forecast for students upon their return to school next year?
I can take this one, unless somebody else wants to jump in. No.
Please.
You know, I think one of the things that we're going to see with this pandemic for everyone, and students included, is we're going to see probably our mental health response is going to increase as the pandemic resolves. So we're going to see these trends diverge a little bit, because once people are out of this acute stress phase, they're going to have the space to then tend to a little bit more space to tend to whatever the distress was that they're experiencing. So for our students, this may mean coming back to campus, having experienced some traumas related to their own health being threatened, or the health of people that they care about being threatened, financial stability and family livelihood or family structures having been changed. We're also all going to experience a sense of ongoing threat. So right now, going to the grocery store feels a little bit scary, and that's not going to stop just because restaurants and places start to open up again. It's going to take us a while to adjust to being around people and to going places. And so there's going to be some ongoing anxiety that I suspect that will persist even as the pandemic kind of comes to a close. And students, you know, might have, you know, some concerns about just the level of uncertainty that they experience. A lot of things have changed really, really quickly. And once you go through that, it can be hard to not anticipate something like that happening again. So being able to let our students know that we have lessons learned about how to support students, about how to respond when unexpected situations occur, and really just open up our offices and our campuses to and really encouraging students to reach out when they're feeling distressed, and preferably even in the earliest moments of distress, because there's a lot of things we can all experience that are perfectly normal reactions that are not the same as a clinical diagnosis. And if we can get people to check in early, then we can often mitigate the impact of some of those early symptoms.
Thanks. And Heather, kind of on a related question, I think those of us who are working with trainees on the healthcare fronts, whether that's residents, fellows, medical students, what's your advice, to them, because they're on the front lines just like everyone else and are putting themselves at risk, and they're still trainees. They have their whole careers ahead of them. What are some strategies you've taken on to ensure their mental health?
Yeah. So for one thing, I think as pediatricians, we're a little bit protected from the brunt of the epidemic as far as being on the front lines of providing clinical care to COVID patients. And I think other specialties are seeing their residents experience this even more. So for the most part, medical students have been taken off of clinical rotations. Residents at our institution are still completing essential rotations, but for non-essential rotations, they're doing self-study at home. I think we need to have clear communication lines with our residents and really advocate for them and protect them because of their status as trainees. And I think a lot of residents have anxiety and fears on their own, and we as attending physicians can model good self-care practices and provide supportive listening to our residents during this challenging time. I'd also like to just talk briefly about our experience with the global health residents. So as a global health educator, one community of learners that has been affected by this pandemic is trainees who have an interest in global health. And most of those trainees across institutions have been evacuated from their international posts. That includes our trainees at Baylor who spend a year abroad, and I know also other programs around the country who have programs supporting trainees and fellows in international posts for long periods of time have had to make the difficult decision to pull people back. And I think that these trainees are really struggling because they've returned to a changed America and maybe lost some sense of purpose and meaning, feeling guilt from leaving their international sites and uncertainty around when they may be able to go back. So we've supported these global health trainees by helping them logistically transition to life back in America, providing mental health referrals when needed, and opportunities for community building and group reflection. And I think as a global health community, one of the messages that I'm trying to get out to our trainees who have a special interest in global health is that there's really never been a time where the need for global health has been more apparent, and that your dedication to global health is going to be even more necessary today during the response. And after COVID-19 threat has abated, there's going to be a lot of work in global health in terms of rebuilding health systems and helping our countries recover from the havoc that COVID has created. So that's one kind of special group of trainees that I've been doing a lot of work around. And I'm not sure if our other panelists have other thoughts for general support for trainees who might be working on the wards.
Can I make a quick comment? Not related to that, but related to the experiences of students. I think a group of students that may sometimes get forgotten are international students who are far from home. And so as we've heard, most universities ask students to go home. However, international students are remaining on campus because some of them don't have anywhere to go. Also, some of them can't go home either. The borders of their countries have been closed. They're not able to travel, or they don't have the funds to buy a usually expensive ticket to go home. So they're left on campuses trying to figure out what life means here from here on, what this means for them. They're isolated from the friends that they have made in the United States from family members, and they're having to cope with the aftermath or the current situation by themselves. So I think it's important when all returns to normal that this particular group is attended to, that resources are provided to surround them with care and support, and that they're provided opportunities to express what their experience was like, and that that's recognized as well. Because also there could be long-term problems, challenges in returning home eventually, or in a number of months if they're able to return home. So that's a group of students dear to my heart because I was an international student. And I think it's important to recognize that that experience could be unique than domestic students.
Appreciate that, Adobe. So we have time for one last question, and this is for anyone. And I think it's one that I think many folks who are addressing is how do I create boundaries when working at home to separate my home and work? Is that possible, or just give it up?
I would echo what Hansa said earlier about a schedule. I think right now everything feels like the one day bleeds into another. The morning, very quickly turns into the evening somehow. And so starting your day with creating a built-in schedule as best you can. Even if some of the day is just going to be unpredictable, carving out some moments that you feel like you can protect, where you can do some of these things that the folks on the panel have been suggesting. And so that and then for the folks who are in your life, maybe letting them know that this is something you're trying to do. And if they have the capacity, asking if they can give you, a few minutes. And if they're little ones or someone else who maybe doesn't quite understand boundaries, choosing boundaries during moments that are realistic for you, but making sure that we don't just give up when it's hard, but just finding what is realistic, even if it means it's at a less than ideal time or it's much shorter than you would prefer.
So I'd love to add a couple of my 2 cents to that. I agree with everything Rachel said, and also just I guess the other thing is, like, as parents, especially parents who are coping with little kids at home, taking time outs for yourself actually as much as for the kids is really important. If you feel like you're going to lose it, kind of stepping back and saying, I just need to walk away from this for a couple minutes and get myself together. And I guess the other thing I was going to say is just letting go of some of those things. I know I'm on the screen, I'm on the communication media committee at AP, and I should never say that, screens are great as babysitters. But having said that, as a parent, I personally have let go a little bit about the screen time guidelines, just because you got to survive and prioritize what's important, like food, good food on the table if you can afford it, if you're lucky enough to afford it for the kids, structured bedtimes, because the sleep will help everyone, hydration in those walks that you mentioned, Parmi, in the sun, because the sun actually helps your mood as well, and keeps the circadian rhythm on track. Just having those things as part of your structure, but maybe letting go on some of those other things that in quote unquote normal times you'd be chasing them for.
Great. Well, we're out of time, so I want to thank all the panelists for your expertise and taking your time. A virtual standing ovation to all of you, and thanks to all our participants for your attention. Well, at the conclusion of this webinar, you'll be receiving a link to a survey. We would like you just to take a couple of minutes to fill that out and give us some feedback and ways to improve future events. And we'll also be sharing the recording of this webinar as well as the slides, so you can feel free to share those with your networks. So thank you, and hope you guys all have a great rest of your day.
Thank you.
And feel free to email with any, I see some questions to some of us specifically, so feel free to reach out, or I don't know, Parmi, how we can answer some questions that people have.
Yeah, we'll share the slides that have your emails as well, so please.
Okay.
Great.
Thanks, everyone.
Thank you.
Thank you.
Bye-bye.
Bye.